Yeah, thanks, Mr Speaker. My question is also to the Minister for Health. Will the Minister please outline to the House how a stronger economy enables the government to subsidise new medicines, including improving the lives of more than 500,000 Australian patients who have trouble breathing with chronic obstructive pulmonary disease? How does the government's management of the budget allow this to happen in comparison with previous approaches?
The Minister for Health.
Thank you very much, Mr Speaker, and I want to thank the member for Petrie, who comes to this place as a small business owner and operator. Pest control, he can spot a cockroach at 30 paces. And one of the things that he learned is that in order to grow a small business, you need a plan and you need to work hard. And in order to grow an economy, you need a plan and you need to work hard. And in order to have that plan, you need to work on competitiveness to allow your businesses to flourish. And that's what allows 1 million jobs to be created. And that's what allows a government to guarantee essential services. And that's exactly what this government is doing. That's how we came to be able to provide record funding for Medicare, $4.8 billion of additional funding in the last budget, record funding for hospitals, an additional $30 billion over the new hospital funding agreement, record funding for aged care, up $5 billion, and record funding for mental health, up $338 million. Importantly, though, it also means we can provide record funding for new medicines with an ironclad guarantee that if the PBAC recommends it, we will list the new medicines. And on the weekend, I was privileged to be able to announce on behalf of the government that new medicines would be listed for conditions such as type 2 diabetes, ulcerative colitis, renal cancer, but in particular for chronic obstructive pulmonary disease. Now, for most people, the two things that they know most well in this case are emphysema and other related breathing diseases. And what that means is that we have been able to help 600,000 Australians access a simple, single, new medicine which would otherwise not have been available, which would have been out of the reach of the vast majority of Australians. So to put chronic obstructive pulmonary disease on the PBS is a very important thing. Now, I'm also asked, are there alternatives? Yes, there are. We hear from the Leader of the Opposition that this is just the ordinary course of business for government. It's not, because that hasn't always been the case. When Labor was in government, they deliberately denied 7 medicines from being listed on the PBS, including symbicort. And what was symbicort for? Asthma and chronic obstructive pulmonary disease. So in the end, if you want to understand the difference between the two approaches to government, on that side, they can't manage the economy and therefore they can't manage health. They can't commit to delivering what people need. On this side, we manage the economy and we deliver the essential services.